When you should be scared of growing pains. Everybody has heard the horror story of growing pains, where your child got diagnosed with growing pains and then they ended up with something terrible, awful, and very bad. I am Dr. Cliff James with Help Mommy. If you could do me a favor just with the new algorithm so people actually see this, if you can like, comment, share, follow me, anything you do will help the algorithm to show this to other people, because this is something that's very important. Growth pains are something that's extremely common, and they're happening when kids are growing, but they're not necessarily because they're growing. Sometimes it's just the healing pains of all the bumps and bruises and things they do throughout the day. But when they are growing, bones tend to grow faster than ligaments and tendons, and there's some stretch. And, well, it tends to happen at night, and that's when they're going to complain of pain. They're usually going to complain at the ends of bones. So right below the kneecaps, right above the kneecaps, right above the ankles. They're going to want you to rub it. It feels bad. If you see this, some ibuprofen go a long way with helping them. But there are some red flags. If you see these are not growing pains. In fact, you shouldn't see anything with growing pains. If you see any redness, if you see any swelling, if the area feels warm, this is not growing pains. The three horror stories that you worry about is things called osteosarcoma, where the pain will only be in one spot. It should always move around. You should have seen it in multiple places if it's growing pains. But if it's always in the same spot, you should worry. Rheumatoid arthritis, you see red swelling joints. It should be extremely painful, and they don't want you to touch them. That's bad. You need to contact your doctor. And then an infected joint. This is going to be a solitary joint that's red, hot, swollen, and this is a very sick child. You need to be seen right away. This is actually an emergency. So as long as it's just hurting, they like to feel rubbed, it's happening in multiple spots, they're growing, use some ibuprofen, that'll help them. But if you see anything, or if it's always happening in the same spot, you need to contact your doctor.